I'll just kick off by saying the reason we got this little discussion together was we'd noticed a lot of chat in various groups about MGEN, and there were confusing, I know people had various different ideas about how often to test for it, whether you should test or not. So we thought that the best way was to actually have a discussion and ask the experts really, how do we deal with it, and what are the best ways forwards? Can we have a kind of a very robust kind of understanding of, as adult creators, when we're working with each other, what is the best form of testing regarding MGEN? So if I could ask Kerry and hi, Mims, at the bottom there, if you could just give us a bit of an outline about MGEN and what it is really.
Okay, so mycoplasma, I mean, it's something that, generally speaking, is relatively new in sexual health clinics for testing, and you may find clinics outside London or smaller clinics don't test for it at all. And it is one of those things that it's seen as a sexually transmitted infection, but it's not a sexually transmitted infection like gonorrhea or chlamydia. Okay. So with gonorrhea and chlamydia, we test people even if they have absolutely no symptoms, because it's important to know if people have got it and treat it if they've got it, even if they've got no symptoms. And if people have got gonorrhea or chlamydia, if you've got sexual partners, then we ask you to get them treated as well, and we ask you to contact ex-sexual partners or casual partners to get them treated as well. So it can be passed sexually, but if somebody's got mycoplasma, we only ask them to get their current partners treated, or people that they're likely to have sex with again. And if people don't have symptoms, we don't test.
Right. Come on with this, you're going to go out and need the test. The only thing
got somebody chatting in the background.
Yeah. We can't hear.
Maybe people turn their... Maybe people turn their...
Johnny, your audio is on. Did you know that? Okay, I think it's muted.
So yeah, so with mycoplasma, it's not a routine testing clinic. So if you come into a clinic, you routinely get tested for gonorrhea and chlamydia. And if you've got symptoms, you may get tested for other things. But if you come in and you're coming in for a routine screen with no symptoms, we do not test for mycoplasma. And that's not going to be something that will change sort of moving forward. So the guidelines that are written by BASH, which is the British Association of Sexual Health and HIV, which is the major sexual health organisation in the UK, and they write all our guidelines for all different infections. So they have guidelines which are currently being updated, but there is no change in the recommendations, which is people are only tested if they have symptoms. So asymptomatic mycoplasma is not seen as something that needs treatment. It's something that a lot of people have and don't have any symptoms, so it is only a problem if it causes symptoms. So it's not anything that any clinic will do if people don't have symptoms. And symptoms tend to be, you know, a bit like other infections, maybe a pain on urinating, stinging, that sort of thing.
Okay.
So if you don't have that and you come in, we will routinely test you for gonorrhea and chlamydia, even if you haven't got any symptoms, but we won't do mycoplasma. So I know it's been quite a conversation.
I think it has. It's because people see it on, if they have private tests or whatever, and it comes up. So they'll see it and then say, well, why can't I be tested for it? And why can't I be tested for it every month like everything else I get tested for? So that's the first question.
So the thing with going private, I mean, there's no point in comparing private clinics and NHS clinics, because if you go privately, you can have whatever you want because you're paying for it. And we do know that some private clinics rather unscrupulously test people unnecessarily for things. In an NHS clinic, you will only get tested for things that we feel you need testing for, because that is that's the ethical way to behave. So so in NHS clinics, you will only get tested for things that we feel you're at risk of. And like I say, I mean, I know somebody said to me, well, in America, they do things differently. And again, it's different. I mean, it's a different type of healthcare. Their healthcare is often paid for. In the NHS, we work very ethically in testing what people need, not what necessarily they want.
So it's not, we shouldn't be comparing ourselves with the American system. Is that what you're saying?
Yeah. Again, it's like it's a private system, or people pay for their healthcare. So again, things happen differently if you're paying for things, because you lose. There's maybe some level of that you can get tested for lots of different things that you don't necessarily need because you're paying for it.
Mm.
And of course,
I've been in this industry for 15 years, and it's never been something that's ever come out before. So I assumed that obviously it wasn't a problem.
I think it's because, like I said, mycoplasma was not a test that was done in clinics until a number of years ago. So it's something that still people are hearing about, or they've never heard of before. But I think if you're working in your industry, if you're wanting to have regular tests, whether that's monthly or 3 monthly, if you want to do it through the NHS, which we are more than happy to encourage people to do, and to do what we can to facilitate that, but you have to trust what we offer you is what you need. The other thing is, if we tested lots of people for mycoplasma, some people would come back having it, but with no symptoms. And if we're treating people with antibiotics, that's not healthy to give people antibiotics they don't need, because it also leads to antibiotic resistance. And we already have that problem in the UK with some antibiotics for sexually transmitted infections. And we really don't want to have any more antibiotic resistance. So we don't want to test people unnecessarily and then treat people unnecessarily for things that they don't need.
Sure. Yeah.
So does it clear up on its own then?
Well, yes. I mean, if you don't have any symptoms, it's not causing any problems. So it's not something that needs to be tested for or treated.
Okay. So does anybody have any questions regarding MGEN itself, as in,
just full disclosure, and I mean, I'm not a doctor. The consultant that I work with was unable to make the meetings. So, I think that I can't go into sort of, the whys and wherefores, particularly of what infection is or anything like that, except that, like I said, I guess really all you need to know is that it's an infection that if you have symptoms, then it's good to be treated, because we don't want anybody to have unnecessary symptoms. So,
So we're saying if you've got symptoms and you've tested for everything already and it's coming up negative, then you want to get yourself tested for MGEN.
If when you come in, if the symptoms that you have, the doctor or the nurse feel are linked to mycoplasma, in which case, yes, they will absolutely test people for it. So please feel reassured that if you come in with symptoms, depending on what the symptoms are and what the doctor or the nurse think, they will test you for all the things that you need to be tested for. I think it's about...
There's a question in the chat.
Oh, sorry, go on. I can't see that. Hang on.
Yeah, sorry, it was me in the chat, just off. So you're saying we don't test necessarily unless there are symptoms. Does that mean if there are no symptoms, then it's not a threat to your health? You're probably going to fight it off. But if you develop symptoms, then you need the antibiotics. You've not been able to fight it off.
Yeah, well, just because we don't want anybody to have, it's like, I mean, there are lots of things that people have symptoms for that's like bacterial vaginosis. People who have unpleasant symptoms, even if it's not a life-threatening or dangerous infection, it's good to treat people because you don't want to have unpleasant symptoms. And that's, that's the same with mycoplasma. It's one of those things that if there are symptoms, we will definitely test if we feel the symptoms are relevant. Then it's definitely it's one of those things that's... What I'm
asking though is, if there are no symptoms, then there's no threat to health. Is that what we're getting at?
No, because if we thought there was a threat to health, then we would test people even if they didn't have symptoms, like with gonorrhea and chlamydia. If you've got no symptoms but you've got one of those, yes, it can cause complications. So So that's why, in a way, it's not like other sexually transmitted infections, because we absolutely encourage people to test for gonorrhea and chlamydia when they've got no symptoms at all.
Yeah.
So absolutely is what you're saying.
Yeah, cool. Thank you.
I think I've got Mim messaging me on WhatsApp. Mim, are you in the room?
Yeah, so we're here. Can you see us?
Oh yeah, we can see you.
Yeah.
Dean Street's here, don't worry. So we've got one of our
Okay.
consultants on the call as well. So one of our lead consultants on the call. So we did do actually a presentation for you.
Perfect.
I know.
Yes, please.
Yes, we love it.
But what I'll do is, Tara, you're on the call. Do you want to start first? Or shall I do the presentation?
Whatever you want to do, Mim. Do you want me to do it? Do you want to do it?
No, you do it. If you're better at sharing screens and shit, honestly, I'm not good at it.
I give it a go. Hi everyone. I'm Tara.
Hi.
I'm a consultant at Dean Street. I work with Mim and Sophie. So got pulled into this. So we did try and put together a presentation. Let me see if I can share the screen. Oh, it says host disabled participant screen sharing. I don't know if the host can enable it. If not, I can just read out the major facts for you guys.
Let me take a look. I'll see what I can do.
Thank you. Thank you.
Thank you for sourcing this for us today, Mim. Everybody must know Mim from Dean Street. You see her face quite regularly.
So do you know what? If you've got Tara,
I can.
I didn't know Tara was on the call. So I'm completely unnecessary to your Zoom, because I mean our consultant couldn't make it. So if you've got Tara's consultant, that's perfect. You should have said, and then I could have just.
I pulled Mim in, and I didn't realise she'd put this together for us. So thank you.
Okay. So I'm going to need to leave in about 10 minutes anyway. Is the consultant, so.
Thank you, Kerry. I really appreciate your input today.
Yes, thank you.
And if you want to kind of duck out, absolutely, please do.
Hi, guys. Hi. So I work at Dean Street, and I was going to start by saying I'm not a world or UK expert on mycoplasma, but actually nobody is, to be honest. This is something that's all quite new to us. But let me see if I can move the slides on. So mycoplasma is a bacterial infection, can be transmitted sexually, and it's been around for years, actually. And I know in Europe, they've tested it for a long, long time. It's found in the genital tract. So that's like in the vagina, on the cervix, or in the urethra, the tube in the penis. And it can less commonly be found in the throat, and less commonly it's found in the bum, and sometimes it can be in the throat, but it's really uncommon sites for it to be in those areas. And I think that this is the most important part. So if you look at the general population of Britain, so I'm talking general population, so not the people having sex, the whole adult population, so that will include people not having sex, older people who may not be having sex or may be having sex. MGEN, if you tested everybody today in England, you will find it in 1 to 2% of people. Okay, so that's really important, and that's why you do not want to be testing for this regularly. And in people who come to clinics like ours at Dean Street, if we tested everyone in the waiting room, between 4 and 38% will be positive. Okay, so it's out there. People are carrying it, but most of them are not having problems from it. And the risk of transmitting it via sex, so, you know, if you have chlamydia and you have sex, it's not 100% that you're going to pass that chlamydia on to someone, but you might. But the risk of transmitting mycoplasma by one episode of sex is less than it would be for chlamydia. So it's less transmissible than chlamydia. So, and even the people who have symptoms and problems that come to our clinic. So if men come in and they've got discharge or dysuria, still then MGEN will only be responsible for about 10 to 15% of that. So you've still got to remember that chlamydia and gonorrhea are much more likely to cause the problems that we see rather than MGEN. And in females with pelvic pain or bleeding after sex, only 5 to 10% would still then test positive for MGEN. Most people, if we if we pick MGEN up, they're asymptomatic and they clear without treatment. But this is done in trials because actually we don't test our asymptomatic patients because there is no benefit to doing that. So, so it's transmitted through unprotected sex. We've said that. You can't get it through kissing. You can't get it through hugging or from toilet seats. And if you do catch MGEN, it's going to take 1 to 3 weeks before that becomes positive. Okay, so the incubation period is similar to gonorrhea, I would say. So the problem with is if you want to be tested for it every month, again, zero indication to be doing that because many of you will then come up positive even though you had no symptoms, is that the current treatments for MGEN are not great. They are not great. So we haven't really got a brilliant antibiotic treatment. For chlamydia, doxycycline works. For your gonorrhea, you get your KEF injection. For MGEN, we give you a treatment that we hope will work, but it may not. There is a lot of what we call resistant MGEN out there. So people can end up with having multiple courses of antibiotics, which can then lead to antibiotic resistance, which could then potentially impact antibiotic resistance for your chlamydia gonorrheas in the future. And we didn't need to treat you anyway because it was not harming you. So why some people have MGEN and they get problems and why others don't, we don't fully understand. Okay, we just don't fully understand that. The other important thing for you guys is to say that we would advise a test of cure. So that's a test to make sure that, that the MGEN is gone at 6 weeks. Although actually from data that was presented this morning, it looks like 3 to 4 weeks is fine, but 21%, so 1 in 5 people are still going to be positive, even though they've had treatment at their test of cure at 6 weeks. So what you really do not want to be doing is testing for MGEN for asymptomatic that's causing you no problems. You could then end up being positive for months and months and months and then not able to work. If you have been told you're a contact of MGEN, if you are a regular contact, we will offer you testing and treatment, but that is not for your benefit. That is to protect the person that is positive for MGEN. So we only really are treating people as contacts to stop reinfection to the person who's got the MGEN and has got problems with it. We're not actually doing it to protect you. So any casual partners we wouldn't give treatment for, even if it was the casual partner that infected that person. Yeah, like Kerry said, we can test in London. Smaller clinics outside of London may not have access to MGEN testing. And it's important that the problems that I've said that you may get with MGEN are much more likely to be chlamydia gonorrhea related rather than MGEN related. So we would only test for MGEN if people are coming in with these sorts of problems and we've excluded chlamydia and gonorrhea first, because that's still the biggest cause of these symptoms. This is Mim's work. This is her talk, but they said they tested in people with symptoms, 76% of people, and still only 10% were positive for MGEN. So even if you're symptomatic, it's unlikely to be MGEN that's giving you the problem. Okay, so if you're asymptomatic, you do not want to be doing this test because so many of you will test positive and end up in a never-ending loop of positive results for no indication. So yeah, Mim put this big and bold. Unless you have symptoms and chlamydia and gonorrhea have been excluded, we do not need to be testing routinely for MGEN. And that's all. I'm going to stop sharing and just see if anybody has any questions about that.
That's brilliant. Thank you so
much.
Yeah,
that was amazing. Thank you, guys.
Brilliant.
Thanks, Tara.
Oh.
Also, just to say that I appreciate there is a big disparity between private tests and NHS. Genuinely, and I mean this from the bottom of my heart as a doctor, if a test was indicated and needed, we would do it. It's not about money. It's not about money. In the grand scheme of things, these tests are cheap as chips, do you know, compared to a cancer treatment. If we thought for people's health, people needed MGEN testing, we would do it. We've got a duty of care to people, but we just don't need to. And you guys really, you'll never work again if you start doing these tests every month. We'd, you know, like Dean Street, we earn a fortune. We can afford to do these tests for you guys every month if we wanted to, okay? And if it was required, it's not. It's not. And believe me, your industry will grind to a halt because the background prevalence of this infection is so high. So just push back, push back.
Sure. That's a great message.
Yeah, no, I only got tested for MGEN when it came to my infected fallopian tube. So to rule out that it couldn't have been the cause of it, they had to test me for it because of the amount of pain I was in. Otherwise, I wouldn't have been tested for it because it was just to rule it out.
I think what's really important is once
you know what I mean?
the general population,
and I knew nothing about him then.
Once people have an understanding of the fact that it's not a danger to their health if they have it, it's only a danger to their health if they have symptoms. Once people understand that, I think they'll relax a lot.
Mm-hmm. I think it's just a clear message.
Yeah, they need to understand that and also know exactly what the symptoms are and how to look out for them. As opposed to panicking about this new thing, just know how to look out for it.
Mm-hmm. I think, Johnny, did you have a question? I think I saw a question come up from Johnny.
Yeah, can you get MGEN orally or rectally? Because a lot of the places that online where you can test, they only offer vaginal swabs for it or a piss test.
Yeah. So I would say then you can get MGEN in the bum. You can. And we would be able to do a swab for that. Orally, it's so low. And the tests that we have, the swab and the urine, they're probably not validated for rectal and oral infection. But I think I mean, this hasn't been studied. I'm not going to lie. We don't know a lot about MGEN. You know, even the experts who presented this morning don't know a lot about it. But I mean, orally, the chances of transmission would be, you can never say never in medicine. In medicine, you can never say always never or zero, but as close to zero as you can get. But you could pass it on rectally, but I don't know that the test is validated for a rectal swab.
Right.
But if people had symptoms, if people have sort of bleeding from the bum and we've excluded chlamydia, gonorrhea, we would then probably do an MGEN swab. Can't do any harm.
So
is it, so I'm sort of seeing it's a bit like the lady said before, in the sense obviously it's not the same thing, but it's in the same sort of vein as like bacterial vaginosis or something like that. Like, you know, if you have it, then you get, you know, like then you sort it out, and obviously you don't want to transfer anything like that on. But, you know, obviously if you don't, it's not something you test for all the time.
Yeah. So I suppose it's slightly different because bacterial vaginosis, I guess you can't pass on to someone, but yeah, it's an infection. It's been around, and I know for us it's new, but I just learned today it was born the same year as me. So, and I've been around a long time. So but I think it's just that if it's in your body and you haven't got any problems, it isn't going to harm you. But even if you do have problems, it's much more likely to be something else other than MGEN. But now we have a test in the UK for it. Let's rule it out. But we always would rule out chlamydia, gonorrhea first. So say somebody came with discharge to us, we wouldn't do it on their first visit. We would treat for chlamydia, gonorrhea first, and then only if those symptoms persisted would we even bother testing for MGEN. It's just something we know down the line can cause it. But yeah, it's nothing to worry. And actually, being tested and being treated for it, I honestly guarantee you is going to be causing more problems than it will ever cause. Because the treatments, you know, if we have, it's our heart sink question when a junior doctor says they were tested for MGEN, they've been treated with blah, blah. It's been tested as macrolide resistant, so resistant to one class of antibiotics. What shall I do next? And we as a group of consultants don't know. And what we don't want to be doing is throwing loads of antibiotics at people who may need these antibiotics in the future for bacteria or viruses that are causing you problems.
So because males obviously test slightly differently to females, and Johnny was asking about rectal, so what you're saying is your first port of call is always, is it chlamydia or gonorrhea? And then if that's all clear, then you move on to, could it be?
Yeah, so we wouldn't, so say someone came in with rectal bleeding or whatever, we would do all our routine stuff first. We don't think about MGEN because it's so unlikely. And so we would do our swabs for chlamydia, gonorrhea. Often we give treatment empirically, you know, to try and clear things up. And only if that person returned to us and things were no better and we'd ruled out chlamydia, gonorrhea, would we even think about testing for MGEN at that point, because it's so unlikely to be that. And also, so if say we did the chlamydia, gonorrhea swab and the MGEN at the same time, and we treat it and the MGEN came back positive, it may just be it was incidentally there.
Right.
That's the thing. And that wasn't actually the thing that's causing the problem.
That's the interesting part of it, isn't it? That it can incidentally be present.
Yeah. So if somebody has gonorrhea in their bum, and we do gonorrhea, chlamydia, and MGEN testing at the same time, and the MGEN comes back positive, we have a duty of care to then treat that. But actually, it's more likely it was just the gonorrhea causing the issue. And if we just treated that alone, it would gone. But now we've got a positive MGEN test. We have to give you longer courses of antibiotics. We've got to do a test of cure. 1 in 5 chance at 3 to 4 weeks, that's going to be positive. And then you're still not going to be able to work. And we're going to have to give you further line treatment. And it just opens a big can of worms that we didn't need to open.
So I'm getting the underlying message is it's not a big deal. It's not one of the main 5 that we test for every 28 days to keep all of us safe. If it does show, then it may go by itself, or if it is persistent, you will treat it.
Only if it's persistent and it's causing people problems, like bleeding, pain, discharge, dysuria, something like that. Yeah. But we would only be doing the test then anyway, because if somebody didn't have problems, we would never do the test. We would never know.
Yeah. Yeah. I think that's a really important message, because there's been so much confusion amongst so many people, because some are looking to what America are doing, some are looking at private tests only, so obviously you get so many more different, you know, kind of things you're tested for, and the confusion comes when somebody thinks they've tested or they have tested for it, and then it's like the 6 degrees of separation. So many more people are then involved in that connection that it could put half the industry out.
Yeah, absolutely.
We're talking about MGEN. We're not talking about HIV. We're not talking about, you know, things that can close the industry down. We're talking about, so it's that bringing that level of panic down to very sensible, you know, where does this sit amongst what we test for regularly and what we can or not pass on to each other in our line of work.
And I would really advise against, even if you're a millionaire, I would advise against going to a private lab to get it tested, because they'll probably do the test and it'll come back positive, or hopefully negative, but say it comes back positive. The private labs probably don't have access like we do for resistance testing, and therefore they could be throwing antibiotics at you for a resistant strain of MGEN. So actually you could end up in a lot of problems. If we as medical and nursing staff thought that this was important, we would do it for you. It's not about money. In the grand scheme of the NHS, an MGEN test isn't money. It's not the money. The reason we're not doing it, it's because for population health.
Okay. And I mean, we're London centric, got a lot of us. What about for the rest of the country? Because that's where a lot of the confusion comes in, what other clinics are saying, and what they're testing, what they won't, etc. So who is kind of regional and has problems getting tests or finding out information? Is there anyone here?
I mean, I've got to travel depending on our travel, 2 to 4 hours sort of thing to get tested, because a lot of the clinics round in sort of like the Wales area just are awful.
I think we because we have Dean Street and Hammersmith, we're kind of very, very fortunate that we can have such a kind of a good information back. Quite often people in the further out regions are having problems getting certificates, first of all, in the first place, or getting what they want testing, and they're getting kind of not the same information back. So I was hoping that there would be representation that
I think, Lacey, the major sexual health clinics across England and Wales, maybe, they should now be offering the testing. We've had it a few years, but you're right in terms of information. If you want us, me, Mim and Soph, to come and speak to people who are groups outside of London, more than happy to do that, because
thank you. That is just having that flat over the whole industry, having the same message about MGEN, so people aren't panicking. But also that presentation would be great if we could put that on our Snap website and link people to that, so that they can kind of, if they've not been able to attend today, they can kind of go to that and see what you put up as your
Lacey, is this being recorded?
Yeah.
Audio, yes. Recording, yes. Is that okay?
Yeah,
yes.
If anyone's got any burning questions.
Yeah.
Me and Sophie are so pleased that we've called Tara onto this call.
No, I was just like,
well, there's been a lot of talk, Mim. There's been a lot of talk, Mim, that apparently you might be working on trying to open up more clinics, but more north. Is that correct?
I'm opening up my own clinics.
Apparently they're trying to, no, not you, but they're trying to open up more clinics up north. Is that correct?
Don't know is the answer.
Okay.
I actually don't know. I only deal with that. I don't know how to start the M25, to be honest. I'm Dean Street through and through.
Yeah. Someone mentioned that there might be something happening, so I thought I'd just clarify that with you.
It might be, you might be confusing. I've got a secondment, so obviously I'm based at Dean Street, but I'm going round to other clinics in my directory. It's not out north, or it's still in London.
It's going to stay in London. Okay.
Yeah.
Just one question.
We've got a question from Pussycat as well. She's got her hand up.
Okay. Do you want to go first, Pussycat? Pussycat, did you want to ask your question first?
No, I'm having a malfunction. I don't know how I put my hand up. I'm sorry.
So just a question about MGEN, and if you do have it and you have it for a long time, are there any long-term effects or side effects of carrying the MGEN infection?
I think the truth is we don't know, but no, because I guess, but you would never know that because if there were long-term effects, you would get symptoms and problems, and therefore you would present to us, gynecology or GP or whatever, and then eventually get tested. But I don't think, because I guess we've only started testing for it in the UK recently. I mean, yes, PID, infertility, I think one person was talking, that would be a long-term effect, but it's a bit like the whole chlamydia thing, isn't it? I think that the chlamydia makes you infertile was a bit of a shock tactic to get young people tested. Most infertility is not due to long-term chlamydia infection, but I guess you just wouldn't know if you'd had it long-term because you wouldn't have had a test unless you had a symptom. So
so it's chicken and egg, really. So even if you're asymptomatic, even if you're asymptomatic, you wouldn't know if whatever symptoms you did finally have might have been effect from having long-term. I'm just trying to cover all different questions.
Pussycat's got her hand up again. I don't know if that's and Marcus has got his hand up.
No, it was on purpose this time. I figured it out. I didn't realize it was a feature before. I was just putting in. So it basically is basically thinking about the simplest way to pass this information on to other people is the answer. If you have no symptoms, you have no problem.
Perfect. Yes, I like that.
I'm happy with that. So it's for one of a different example, maybe, because there's still a lot of like people that get a bit scared about this. It's very similar to herpes. Unless you have an outbreak, you have symptoms, that's where your body's not able to fight it off. You need the help. You need the antibiotics. No symptoms, don't worry about it.
No symptoms, don't worry about it. And if you have got symptoms, it's much more likely to be chlamydia gonorrhea than it's ever likely to be mycoplasma.
And I was also told, no idea the actual source reliability, the testing for mycoplasma, similarly to chlamydia, can sometimes give you false positives with dead cells. So because this is something that you can fight off yourself, the test itself is technically void anyway, because it might be detecting an infection that you had a week ago that you've already fought off.
Yeah. So the test of cure to make, so even after treatment, we advise a test of cure at 6 weeks, although actually they think it's probably 3 to 4 weeks. So yes. Yeah.
So if you test positive, you might have actually already fought it off. It's just dead cells triggering a positive response when it boils down to it.
Yeah. Cool. But I guess if you've got symptoms that aren't getting better, then we need to consider it.
Well, you need to look into everything. Absolutely. Yeah. But yeah, totally. Cool. Thank you.
Okay.
Marcus?
Yeah, hi. Thanks so much for all this, Tara. I just wanted to ask about the private testing, because I know a few people have ended up having MGEN tests just as part of like a bevy of tests that's part of a package they get privately, that they haven't even asked for it or know about it necessarily. Then it comes up positive, and they think, oh, what do I do? I mean, would you have advice for people in that situation, whether they just got to deal with it then and are out of work for 6 weeks plus, or maybe they come to Dean Street to try and do a test of resistance before doing anything? What would you say?
Yeah, exactly. This is why we should be targeting the testing at the right people. You're absolutely right. This is the problem, because when you do a test and you've got a positive result, then you've got to act upon it, don't you? So if you came to Dean Street and said, I've got this private mycoplasma test just because they did it, but I've got no symptoms, I would say don't do anything. But your industry may not say that, because you've just got this piece of paper that says you're positive for something. So this is why I say don't do it. If you needed to do it, we would do it for you. So for your health, if you've got this positive mycoplasma, but you've got no symptoms, I wouldn't worry. I would just chill out. But your industry may not allow that, in which case we're then going to give you a barrage of antibiotics that may not work, that you may then end up with resistance down the line, which is exactly why you don't do it. And just to throw something into the mix that I really don't want to get into, as well as mycoplasma, what a lot of the private companies test for is urea plasma. We don't test for that in the UK. It's another sort of bug, even less pathological than mycoplasma. So don't get that either. If there was a need to get it, we would be doing it on the NHS. You're medically clear to shoot if you've got no symptoms and it's positive.
Yes,
but if you go to your industry with this thing saying positive and they're not medically trained or don't understand, they may freak out, which is exactly why you shouldn't do it.
Why you shouldn't do the test in the first place.
Yeah.
But some people are in a situation. I couldn't hear that, April. I think some people are in the situation where they can't get to a clinic, so they do
go to Dean Street to get tested. Yeah. Yeah, I know, but the thing is, it comes down to the same. That I mean, I know, like obviously Rocky, she comes all the way from Wales every month to get her test from Dean Street. I also know some that come all the way from Manchester just to get their Dean Street test, to meet the dawn of time. And we've always gone there, no matter how far away they were. That's where we went. In fact, we never ever accepted the home.
April, you're going to have to type, I think.
What's that? it's hard
is this?
April, we can't hear a word.
It's like an alien.
Yeah,
Sorry, April.
we can't hear anything. It's just noise.
Where is this related?
Sorry. I feel for you.
It's made Lola happy though.
Sorry. Hi, Lola. I thought you had a question, but you just.
I think Pussycat's got her hand up again.
Oh.
Hi, Pussycat. Did you have a question?
Yeah, so just with the mindset, so what Marcus was touching on before, I know a few people that are doing the comprehensive home test from one of the online home kit things, and this includes mycoplasma as a standard. Is there anything that can be done to reach out to companies like this to ask them to retract it from like their standard available as your monthly, this is the all singing, all dancing private test for sex workers, when actually they're testing for loads of stuff that they don't need to be? But that's actually a really common go-to for a lot of people in the industry. Can we, who do we need to talk to in order to stop them from offering that as a standard? Because I think that's where it stemmed from in myself. I got an indirect exposure from somebody who worked with somebody who was using these home tests, who suddenly tested positive, and then all of a sudden it's like, well, I have no idea what to do with that information. But if that company wasn't offering that as their standard, this is a go-to for a lot of sex workers that are using that as their go-to, that can't get to the monthly Dean Street clinic or use that as their fortnightly checkup. If that wasn't on there, this little bit of extra level of panic maybe could be avoided by nipping it in the bud there.
Is there a way on those tests, Pussycat, that you can choose the ones that you want tested, or do they just blanket do? Is it a blood test?
As far as I'm aware, it's just a comprehensive one, so that it's like the most expensive one that's on there tests for all of this, all of that, and that's it. But it's I can't think if it's off the SH website or like I believe it's like a medically accredited website. It's a trustable, it's really popular for people to use. If they're getting this as their blanket treatment, like this is what we expect because it's a comprehensive test, they're not offering a middle ground.
No, so they don't offer you the ability to choose which one they test you for. You have to have the whole package.
Yeah, that's it.
Right, and that's where the confusions are coming in, because some things are popping up.
They're getting tested for these things routinely just because that's included with the package that covers them for what we need as sex workers within the industry. It covers like the 5 main ones, but it also covers all this extra stuff, which they suddenly think is part of routine testing, but it's not. It's just this clinic that they're using that does it that way. We need to find a way to contact these, like to get above this, to get above the people that are putting these plans together.
I think you're absolutely right. I think you're 100% right, because we get patients, not this cohort that I'm speaking to here, but so many patients that come because they've gone private testing and they've come back positive with this thing, and then we've got to deal with it. But I think you're right, but I think you would have a battle, but you seem like a group that would battle, because obviously they're making extra money from you by doing it and actually just causing a lot of problems. But yeah, that would definitely be a great thing if you could do that.
That may be something to think about, Pussycat, to try and contact.
We just need to find out who the people are above the people just administrating the medicine. It's not necessarily them making the decisions for the business if it's a private clinic.
Yes, exactly. And just say that the package we need is A, B, C, and D for this industry, so that they can maybe target better what results we need to see.
I have tried this recently with a private clinic and failed miserably, but yeah, keep trying.
Yeah, we all try. Maybe.
Yeah, keep trying.
Yeah.
We've got Ruby and Mark have got their hands up as well.
Ruby, you can go first.
Thank you. Appreciate that. This is kind of less for me, but probably more so for other people. So obviously it looks like we can't choose. I would assume it depends who you go to if you do a private test. If you can, obviously, if you can't, sorry, I'm not making sense. If you have the option not to pick it, then obviously don't. But I'd imagine, obviously, if you're going to work in Europe or America, then just then to take it. Is that the advice in that sense?
I guess if it's a work thing you're going for in America and they're insisting that they want to see that result, that would be a decision for you to say whether you want to test for it.
Right.
As yet, I've not been asked for it in Europe. I don't know about America, but I haven't been asked for it in Europe.
Okay, right, that makes it clearer. Thank you.
I don't know if that will change, because I know obviously America have had their own sort of dealings with this, but yeah.
Okay.
I'll ask my question. I don't know if it's actually a question or a request, really. And I'm playing devil's advocate here. Obviously, the UK battles Europe and America when it comes to testing, when it comes to different things. They have one set of rules and we go by a lot of the NHS. Would it be possible to get, and this is just a request, maybe a statement from you guys to say, right, this is what it is, this is what we do in the UK? Because we're obviously probably going to get some resistance probably from other people. So what would probably help us if we had some sort of statement or some sort of something that we can use, put on Snap, and we can obviously publicise and put out to UK people. Obviously, if they go to these countries and they want these testing, then you have to do what you need to do. But is it something that we can get from you guys at all?
Oh gosh, I don't know. I mean, we can certainly, because our sort of major body in the UK is like BASH, British Association of Sexual Health and HIV, and they have current guidelines on mycoplasma, which do not recommend routine testing in asymptomatic people. So we could write something about what BASH says. I don't know if I would have much clout in America, but we can certainly sort of rehash that that this is not what is recommended testing in Britain.
It's not necessarily they can use it then. It's just that when they start bashing us, because they will always bash us. That's what they do. It's just something, and then a lot of performers within the UK will kick up a stink and say, well, that's what they're doing over there. That's what we got to do. And if we kind of had something to say, well, they do what they do. This is what we do. It's just something that we can use to performers within the UK, I think.
Yeah, no, I'm sure we could, because the guideline is out there and published. Do you know what I mean? So we can just take the sentences from that and put something together, because then it isn't sort of me as an individual saying it, it's the sort of whole British Association. So we could just take a few sentences out and make something snappy for you. Yep. And then you can remind me to do that.
And also, if we can put your presentation on the Snap website, because you set out really clearly what MGEN is, what MGEN is. Call it MGEN.
Yes, I knocked it together in about 5 minutes this morning, but I'll make it look nicer, and then you can absolutely have it 100%.
I think that will be really, because it is really clear. I think that would be good as well.
We've got Mim and Paul have also got their hands up. Sorry.
Hi.
So my thing was, I was speaking to someone yesterday, one of the porn stars, and of course the first question that comes up, which always comes up in every conversation, is MGEN. The American industry, I'm not slating the American industry, but it seems that the Americans do charge for their medical stuff. So are the Americans going to one type of clinic to get this MGEN testing that they so desperately want? Is it something to do with money by any chance from the medical? Because some of the patients that come in, not the porn industry, but some patients come in to me and they're tested for things in America they really don't need to be tested for, like liver function for PrEP. It's not processed through your liver, it's processed through your kidney, but they'll charge an extra $100 for it. So do you think it's something to do with that?
It could well be in America, yes, it could well be, because they have always paid for their certs, haven't they? It is always people pay for their medication.
I saw when I was in America, I saw a price list, And like for a Hep B vaccine, it was like $88. For a HPV, it was like $160. So God knows what they charge for an MGen test. Do you get me? I think it's a lot to do with that as well in America.
Yes, definitely. I would say so. Yes.
Okay. And Paul got his hand up. Paul Rain.
Yeah, just as part of what just going back to Ruby, really. We've been working with a European performer for the last 2 days. We were talking to her about MGen and whether they thought it was a problem and all the rest of it. And she sort of laughed about it. I think in answer to Ruby's question about Europe, I don't think it's something that they're worried about on the continent at all. Not from my conversations with Nikki over the last couple of days about it.
Okay, thank you.
Hey, does anybody have any other questions? Lola.
Hello. Can you hear me?
Yes.
Oh, hello everybody. Hi everyone. Oh, obviously I've missed quite a lot because obviously I had to go through and find the link to get on the Zoom. So basically, in reference to the whole MGen thing, I know obviously Mim doesn't like that word. Talking from you. So if you're not showing any symptoms, then I assume you don't need to be tested for MGen. And as obviously you were having the conversation before, if obviously it's required for you to have an MGen test, it is then down to your own discretion whether or not to do it or not, if you want to work with that company or those people. Is that correct? Okay, then. Just wanted to know. Sorry, because I must have missed like everything that was very informative at the beginning.
That's fine. I think in order just to sum up, because we're coming up to our time now.
Yeah.
Would who would like to sum up? Would you, Tara, like to sum up just for us in terms of as an industry, how do we look at this question of MGen?
Yeah, I think it's in the chat. MGen, no symptoms, no problem. I think that's it, really. I think do not test unless it has been indicated by a professional, because there is lots of asymptomatic MGen out there. You could instantly test positive and it could just stop you working. So, and if you can avoid getting it done through a private company, then do that, you know. If you need an MGen test, it will be sort of a doctor or a nurse that will tell you need it, but no symptoms, asymptomatic, don't do it.
Perfect. Thank you so much. I really appreciate Dean Street for your input today. You've been invaluable for the presentation. Fantastic. Thank you, Mim. Thank you. Is it Sarah? Sorry. Sorry. Thank you so much for being here. Thank you so much. Everyone, actually, it's been really, really interesting and informative. And I hope that we can take the information we've had today and spread it to anybody else who's asking who didn't manage to get to this meeting. And also we'll put as much information on the SNAP website, so direct people to that if they are asking, and we will have a recording, if that's okay with everyone, that the audio can be listened to if people have missed out. Is that fine? Yeah.
Yep. If anyone asks me or Sophie about MGen again, we're going to refer you to the SNAP website.
Send them straight to SNAP. So thank you very much, everybody. Really appreciate it.
Thank you, everyone.
Thank you. Bye.
Bye.
Bye.